Okay. Good evening. We're going to begin our program. My name is Sean Gallagher, the principal of Beverly High School, and I'd like to welcome everybody that is here today. Also, appreciate your attendance for parents and guardians, and then we also have many of our spring teams participating after school games. So you'll be seeing some of our teams as they come back. There'll be student athletes and coaches will also be attending on their way back after a big win, we hope. First of all, I just want to mention, please take a look at the program today for the parents, guardians, and students that are here. There are a lot of great resources, both at the state and the local level, that we've highlighted. And I'd also, anytime you put together such a comprehensive program, there's a lot of people to be recognized. And in that program, there are some people that we recognize, and we truly appreciate all of their efforts. And then also, the last piece of that is part, and you'll hear this throughout the night, of how much collaboration between all the law enforcement agencies, the medical professionals, the school resources, all the different state agencies also. We have a memorandum of understanding, and the number one aspect of all schools in the Commonwealth is to provide a safe environment for learning. And also on that program, we also work with the DA's office and a lot of the other schools. They do the drug sweeps with the K-9s in the correction office. So that is part of one of our policies that we may explore between now and the end of the school year to make sure that our schools are safe and drug-free. So that's also wanted to bring your attention to that. So as parents and guardians and the students, I always like to say we passed the first test. And the first test for us as parents is not to be a denier. You know, how often do I hear, I've been working with high school students since age 19, so one of the youngest coaches in the Commonwealth for over 25 years. I've been exclusively working with teenagers. And how often do we hear, I could never imagine that, or I can't believe something like that could happen, or I never thought that person would be involved in drugs. I can't believe they were rushed to the hospital. How did they overdose? All of those pieces, we talk about denial. So the first step for us as parents, guardians, and students is to accept the reality of the hazards and dangers of getting involved in drug and alcohol use. So if you can't imagine a loved one or a friend or a classmate becoming an addict, overdosing, drinking and driving, and getting involved with these substances, that denial will block you from recognizing potential problems. Everyone here tonight is willing to accept that reality that's among us in our society. We're willing to learn, we're willing to know, but most of all, as parents and guardians, we're willing to think of those difficult thoughts regarding substance use and abuse among the people we love, which is our children. When we can think like that, we consider the possibility, and we can open our minds in efforts in preventing and talking with our children. Because once drugs and alcohol takes hold of different lives in our families, it has devastating effects. And from working with students all these years, I can tell you, to me, it's one of the biggest obstacles and struggles that families deal with. As we all know, all the research shows, the longer we can prolong drug and alcohol use among our teens, the longer they go without using, the less likely they'll have problems later on in life. I think we have a great presentation for everybody here tonight. I applaud you all for being here and listening to what we have to offer. Thank you. This is just an overview of what we'd like to discuss tonight. The multiple task approach, adolescent trends regarding substance use and abuse, recognitions and symptoms of use, recovery and treatment options, and last, a lot of prevention education programming. many of you have received a lot of the information as you were coming in this evening. So at this time, I'd like to have Dr. Hershey come on up and say a few words. Our Superintendent of Schools, Dr. Stephen Hershey.
Actually, I'm a little worried where Sean got that picture. I think it was a few years ago. One of the things I want to do this evening is really thank all of you for being here. This is an important topic for the community, and I want to laud the fact that as a Beverly community, we are now addressing this as a community issue, because it is. The safety of our kids is on all of us, and the safety of the adults in the community is just as important to the school district as it is to the mayor's office or the police department. So I really want to thank the mayor, police chief, the district attorney Blodgett, and all of the people that worked on the task force, which included school committee representation, around putting together not only this evening, but the evening that we already put together. And we have made a commitment that over the next several years, we will have a plan to make sure that people have the information that they need, know who to talk to if they have some concerns, and we can ensure that the kids are well taken care of in our community, and that we in Beverly can be really comfortable around their safety. So I want to thank you for coming this evening. It's very important to us as a school district, but it's incredibly important to the Beverly community. Thank you.
Good evening, I'm Mayor Mike Cahill. Tonight we start the public dialogue about an issue communities tend not to want to acknowledge. When it comes to drug and alcohol abuse and addiction, Beverly is no different than any other community anywhere in this world. There is drug and alcohol use and addiction in every school district in this world. There is drug and alcohol use and addiction in every neighborhood in this world. Every one of us knows the face of addiction, and every one of us knows lives that have been destroyed by addiction. Earlier this year, working with District Attorney John Blodgett in his office, along with the Beverly Public Schools, Beverly Police, and other key partners, my administration launched an effort to fight back against addiction in our community. Our focus will be on education, treatment, and enforcement. In partnership with District Attorney Blodgett's office, we'll sponsor a series of forums educating our community on the harsh realities of drug use. For those already caught up in drug use, we will work to increase treatment opportunities. And thanks in part to a state grant that created the Beverly Gloucester Danvers Opiate Task Force, we will redouble our efforts to arrest drug dealers, help the DA's office prosecute them successfully, and get their poison out of our community. Tonight you will hear from talented professionals who understand addiction and bring real strategies to help us build a healthier community. There are multiple underlying causes for addiction. There are multiple pathways to addiction. While I am not an expert in addiction, I want to be part of the answer in Beverly, just like you do. One thing I do know is that we all have a responsibility, both individually and as a community, to help our children develop as healthy people. And a strong sense of self-worth and self-respect with a core belief in themselves and their right to happiness and good health in all aspects of their lives is a great place to start. And while that's not a guarantee, a strong belief in oneself is critically important for us all. Drugs steal people's dreams, their ambition, and their peace of mind. Drugs wound many families deeply, and in fact, destroy many others. Drugs kill our sons, our daughters, brothers, sisters, and parents. And for too long, the stigmas associated with addiction have kept communities from calling addiction what it is and attacking it head on. A disease, a sickness, an illness. Addiction can afflict your loved ones and mine. Good, kind, talented, loving, and beautiful people fall prey to this illness People with great gifts to share with the world are denied that opportunity, and we are denied their gifts. Let's break that stigma. Let's fight back against drugs right here at home. I'm committed to fighting against drug use and addiction for as long as I serve as your mayor, and I ask you to join me. And as Dr. Hershey did, I also want to thank you from the bottom of my heart for making the time to be here tonight and to join us in this most important fight for our community's health and its future. Thank you for being here.
Good evening. My name is John Malash. I am the Chief of Police here in the City of Beverly. And again, I want to thank everyone for coming. Basically, one of the things we want to impress upon everybody is, as the Mayor mentioned, we are working on a regional plan to take on this drug epidemic in the area, or in the region, the state, and the whole country. We're working with the other cities in the area, specifically with Gloucester and Danvers in the project that was mentioned. And one of the things we're doing is, when we have major cases, we work with our partners, whether it's the Massachusetts State Police, the federal government, the Drug Enforcement Administration, and we'll work those cases up. Our goal is, if people are arrested for minor drug offenses, or if they're arrested for felony drug offenses, we want to be able to put some of those people into programs to get help. But again, we're going to work those cases up. The information, the intelligence we gather from those cases will work us towards much larger cases, and that's our goal, is to take down the major dealers of heroin and the other illegal drugs, and sometimes prescribed drugs that are being sold illegal in the region. One of the things we do have, if you're not aware, is we have a drug drop-off box in our lobby. If you have old prescriptions that are hanging around the house, if you have elderly relatives that have drugs hanging around the house, we actually bring them into the lobby and just throw them in the box to get rid of them. One thing that's happening now, unfortunately, is people are going to open houses when realtors are there, and they're going to these open houses, they're going through medicine cabinets and taking these prescribed drugs to help their addiction. So one of the things we're looking for is get rid of those drugs, get those drugs out of the house, dispose them in the drug drop-off box, and we make sure they're destroyed. We're also trying to work with other partners in the community, some of the pharmacies where the laws have changed, where they may be able to take some drugs back. We'll pick them up for them and destroy them. If they're not in the houses, they're not going to get to the street, they're not going to get to people that shouldn't have them. One of the other things we're doing is we're working much more in the neighborhoods. My community impact officers and the school resource officers work hand in hand and are out in the neighborhoods. We're trying to go to as many neighborhood meetings as we can and get out and be seen. I want the youth of the city and also the adults to be able to use our people as a resource. When you see a police officer, and I was joking with someone this morning about it, if you walk into Dunkin' Donuts, I know it's kind of a stereotype, but if you walk into Dunkin' Donuts and there's a police officer there, which does happen, engagement conversation, ask them questions. We're there to help. You may have a car you're seeing in the neighborhood quite often. You may have a question about how we do things. Please engage us and ask us questions, and we'll certainly work with you. One of the things I want to talk about is some statistics just in the city of Beverly. In the last 3 months, we responded to about 20 different overdoses of either heroin or fentanyl or a combination thereof. In the last 3 months, we had 10 people who were saved by the use of Narcan, which currently the ambulance service has, and our police officers will soon have it in their cruisers to be able to give immediate first aid when there's overdoses. But there were also 4 fatal overdoses in that period. And before that, we had a spike where we had 3 or 4 in 1 month. So it does happen in Beverly. It doesn't always get reported out because it's becoming almost too commonplace. And I think that's one thing we have to look at. It's a huge problem. In the Commonwealth last year, there were over 1,000 overdose deaths just in the Commonwealth. From 2000 to 2014, there were over 1,000 just in Essex County. The spike from 2014 from 2013 was 3.3%, but it was a 33% rise from 2012 to 2014. So it just shows you the huge problem we're dealing with, the huge increase with the use of heroin and other addictive medications that are causing overdoses and addiction. We ask you to call 911 if you see something. You can call the business line. You can go on Facebook and send us tips or send us messages. We'll look into everything. My detectives are very active. They follow up on every case, every tip we get, we look into, no matter how big or small it is. kind of a couple of side notes I want to talk about is we forget about sometimes high school kids going off to college, and I used to always drive it in my daughter's head, who's now a high school guidance counselor. If you go to a party and someone hands you a drink, you don't take it. Unless you open it, don't take that drink. If you abandon a drink to go do something, let it go. Get another one. I don't care if it's a Diet Coke or whatever it is. Get a fresh new one. Unfortunately, there are people out there who prey on, mostly women, young girls. They'll spike that drink, and horrific things can happen. So just a little side note. I try to impress that every time I have a chance to speak to people. One last thing I want to talk about is, or two last things, but one of those is the problem with OUI is driving while intoxicated and driving while intoxicated while people are using marijuana. It's just as dangerous. If you're smoking marijuana or you're under the influence of a narcotic and driving a car, your ability to drive is significantly impaired. Your motor skills are reduced. You're not paying as much attention. Some people think you can smoke marijuana and drive a car, it's okay, because it's not alcohol. That's not the case. You can be arrested, you can be prosecuted. So again, press that upon the younger ones in the audience, and actually even all of us. And one last thing is I want parents to be parents. Your children have enough friends. They have plenty of friends. This is your time to be their parent. When they're out of the house and they come back to visit, that's when you can be a great friend. But I just want people to, watch what the kids are doing, know where they're going to be. Like I always told my daughter, first time out with somebody, let us know where you're going, what's his name, what's the phone number. We want to make sure everyone's safe, not only on the heroin side, the cocaine side, the illicit drugs, prescribed drugs that shouldn't be out there, but in your general lives, we want you to be safe. Thank you for coming.
I guess that's me. There's only one guy with white hair who's speaking tonight. Although the superintendent had a little white hair. He spoke. Good evening. I'm John Blodgett, district attorney, and I probably speak about this subject more than any other when I talk to different groups in the communities that I am fortunate enough to serve. The topic of heroin overdoses and opiate overdoses is something that I ended up learning about sort of an on-the-job training, and I'll tell you how the journey began. When I became district attorney in 2003, I reached out to all the police chiefs in the 34 cities and towns of this county, and I asked the chiefs what the single biggest issue was that they were facing. And almost to a person, the chief said heroin overdoses. And I was stunned, because in 2003, it really wasn't something that was part of the public discourse, at least not yet. And around 2004, 2005, we still had the discussions about heroin overdoses and heroin in our communities, but it was a whisper. The discussion and discourse was a whisper, and now it's a shout. And thankfully, it is a shout, because the dialogue has to be loud, it has to be often, it has to be fierce, and it has to be right in your face. Because just as what Chief Elisha said, we want people to make good decisions, particularly our kids. We want our kids to make good decisions so they have the chance, they have the opportunity to live good, productive lives and to be good citizens. Last year in Essex County, every single community suffered some heroin overdose or heroin-related incident, whether it was a non-lethal, a lethal overdose, a crime committed because of heroin, but every single community had some incident, some police reported log or some incident involving heroin. It proves the point that we all make in law enforcement, and I think in education, that it isn't indigenous to one community, to one town, rich, poor, white, black, it doesn't matter. It's there. It'll grip you if you let it. And the only way you can beat this, in my opinion, and I think I bring the 13 years of experience as district attorney to this belief, is that you have to fight it on two ends. The first part is the intervention or education piece. You have to be honest with your kids. You have to have that dialogue. You have to make them understand what can happen if they make that one bad decision. Heroin's going to kill you. Could be the first time. It could be the 100th time. But as I tell kids that I speak to all the time throughout the county, if you do heroin, only two things are going to happen to you. You're either going to go to jail or you're going to die. So you have to have that dialogue. I'm asked the question all the time, well, how early is early? I think it's the 5th grade. Educators that I've come to know and respect tell me that 5th grade is when kids become very socially conscious. They know what's going on. They know what's happening in their lives. So I suggest to you, you know your kids better than anybody. Parents are the best anti-drug force out there. To talk to your kids, to talk to your nephews, to talk to your kids' friends. Have the honest dialogue. Hope to make them understand it's just not an option. In my office, we do drug diversion. As a result of the heroin overdose and the beginning of the dialogue that I just talked about in the communities, we developed a unique drug diversion program in 2007 to offer people who've committed a low-level or nonviolent offense, a minor offense, the opportunity to go through drug diversion as opposed to being prosecuted and having a criminal record. If you successfully complete that drug diversion program, which is administered and run by clinicians, then you won't have the criminal record. You won't have the heartache of starting through that revolving door. But make no mistake, the drug diversion that we have, the drug courts that we support, I've been to drug court graduations, and it's nothing short of a miracle to see people who are graduating after having a terrible personal ordeal, what they've been through, who'll stand before the court and the judge and say, but for the prospect of jail, I could not have done this or would not have done this. Drug court, drug diversion, that discussion is nothing like the drug traffickers that the chief spoke about earlier. I will have no quarter and no mercy for people who've made the conscious decision to sell drugs to our children and our citizens in the streets of Essex County. They've made a decision, they've made a choice to destroy neighborhoods bit by bit for profit. And I hope you share the same sentiment I have, because we're compassionate people trying to make this situation a little bit better. And we will help you if you have the throes of addiction. But we will abhor you if you sell drugs for profit to ruin our communities and hurt our kids. And I mention that because there's a lot of dialogue now about ending mandatory minimum sentences for convicted drug traffickers. Unfortunately, there's an awful lot of cliches and slogans being thrown about in the communities, in the public discourse that just aren't true. We don't have mandatory minimum sentences for people charged with possession. And I've talked about what we do in those situations. They're not mandatory minimums. We've had many people go through this system multiple times, and we try to help them get cures. But for people who are convicted of trafficking in those drugs, we have mandatory minimum sentences. And we need that tool to combat, again, those individuals that I've just vilified to you. It's important that the district attorneys in the state and the police department have those tools. And the mandatory minimums are set by weight. There's nothing more transparent, clear, concise, or fair than a penalty set by the weight of the drug that you sell. So I'm saying this to you because I'm hoping that you will support me and speak to your state representative, Jerry Parasola, and my friend, State Senator Joan Lovely, who came in sitting right there in the second row. Let her know that you were with me. Joan has been an ally and a friend in that regard, but I think it's important that you let your lawmakers know that now is not the time. Now is not the time in Essex County to make life easier for drug dealers. Just the opposite. Last year, we suffered 146 deaths in Essex County from heroin overdoses, opiate overdoses. And I suggest to you that's underreported. I suggest to you that there are, in fact, some people who died of opiate overdoses, and it's been listed as something else, organ failure, heart attack. But those are the statistics we have, and we get them in pretty real time. And sadly, this year, as of May 1st, we already have 55 opiate overdose deaths in Essex County. And given that rate, we will break last year's record. That's not something that any of us want to see happen. So I need your help. I need your help to talk about this. If you see something, say something. You're very fortunate in Beverly to have people like the mayor and the chief, Principal Gallagher, who want to do the right thing. Starting from our youth all the way up to our adults in this community. But like me, they need your help. So I thank you for being here tonight. I applaud you for that. Please spread the word, spread the message. Tell Senator Lovely you agree with me and not eliminate mandatory minimums so she can bring that message back to the State House. And I want to especially thank Principal Gallagher. Your spirited principal is going to come up here in a second after me to do his presentation. And following him will be medical experts, far smarter than me, who will tell you the truth about what happens to your children when they do those things that the chief talked about a few minutes ago. So I appreciate you giving me a few moments tonight and a little opportunity to speak to you. I'm always available to talk to you in my office. Our website has our programs I choose to refuse, and we're always willing to help. Thank you very, very much.
Good evening. Thank you all for coming this evening. Right now you see a slide that details the percentage of youth who have used the following drugs in Massachusetts the past month. And I think you've heard some previous speakers talk about heroin and other opiates. And here you see a chart that kind of details some drug use starting at a younger age and starts talking about alcohol and tobacco and marijuana. When we talk about alcohol, we're talking about binge drinking. The opportunity to drink a lot of alcohol in a short period of time for the purpose of becoming intoxicated. And as you can see, that starts at the younger age, and you can see it increase as students get older, and that shouldn't be a surprise to us. But these drugs are also referred to as gateway drugs. And when our previous speakers were talking about heroin and opiates and all those other things, it starts here. And one of the biggest tools that we have is to educate our youth about their dangers at an early age so they're able to make informed decisions, or they're able to make the informed decision to say no to some of these things. Because as we know, the early we can prolong the use, the better the results are. Education is our most important tool at this time to help educate and protect our youth. There are many reasons why teens decide to start experimenting with drugs. Certainly at the age, and you saw the slides before, at the age of adolescence, peer pressure is a very important component of that. They want to fit in. They're influenced by their use, their other friends. They want to try it. Maybe they've grown up in homes where they've seen their parents using and abusing, so they're modeling parents' behavior. Many of you have children who are at adolescent age right now. They don't want to be treated like a child anymore. They want to be treated like an adult. And this is their way to try to fit in and look like an adult. Mr. Gallagher referred to all the student athletes right now who are coming in and they're participating in extracurricular activities, whether it be athletics or the drama club or the varied clubs. Those students who are involved in these extracurricular activities are not going to be bored. They're going to be busy. But those students who have that spare time may start experimenting with these drugs. Again, adolescents, they're trying new things. They want to see they're curious about what it may be. And they want to fit in with their friends to find out and have that high together amongst each other. They're ignorant. They don't have all the facts. And by the time they start trying these things, it's too late. And it goes back to what we said before, the importance of educating our youth about what they're getting themselves into so they can make good decisions. Certainly our youth are going to test limits going forward. That's their idea of rebellion. And it's our job, as the police chief said, to be parents and to set those limits for our children. In today's day and age, right now, a lot of our students, we're seeing a lot of emotional issues and concerns coming through our children in the schools. One of their ways to cope with this is to self-medicate. And there's not an individual in this planet who grew up and said, you know what, I want to be an addict. They didn't say that. And by the time they realize an addict, it's too late. And it's our job as a community to educate them, and those people who need our help, we have to step up and help them. Thank you.
Thank you, Mr. Posca. As Mr. Posca and I were adding to this presentation, we were kind of looking at it, as Mr. Posca said, from kind of the student's perspective and adult perspective, and looking at perceptions. With the legalization of marijuana out in Colorado, if you ask many of our students in Massachusetts, they'll tell you marijuana is legal here also. So the perception of marijuana not being as harmful and being legal in the students' eyes creates a problem. The other piece too, when you statistics show that students truly believe that prescription drugs are safe, because in their eyes, why would a doctor prescribe a drug that's not safe for you? So these are the perceptions that we have from students that add to the problem. And as Mr. Posca said, gateway drugs have not gone away. That peer pressure slide in the 10 common reasons has not gone away in the last 30 years. But what has changed is the potency of the drugs that are out there for our kids. And my next slide that we're going to talk about is some of the myths from adults to children. And some of these we'll touch upon. So we have the 7 myths regarding use. One of them is this. My kid's a good kid. Just one second, let me forward this. Kids are good kids. They won't get into alcohol and other drugs. The fact is that we work with students on a daily basis, and great kids make poor decisions. It has nothing to do with their integrity. It has nothing to do with their success, but sometimes they get themselves in a situation where they make a poor decision. Myth number 2, they'll grow out of it, they'll be okay. And as the medical professionals will be talking, this is the key ages, adolescence and high school ages, for brain development. So there's major impacts on the brain, especially when students start using and abusing substances. Myth number 3, we live in the suburbs. Drugs are just a city problem, inner city problem. Many of the professionals that you'll talk to after, you need 3 things to develop drug addiction. You need money, you need a cell phone, and you need a car. Those are 3 ingredients. So all the statistics show that unfortunately, addiction and substances, it doesn't matter who you are, where you live, how wealthy you are, how smart you are, we're all susceptible. Myth number 4, I'm teaching them to drink responsibility. Well, District Attorney Blodgett will talk to you about the social health law, social host law. The idea of I'm going to provide a safe environment, I'm going to provide alcohol for my children or for my teenager and their friends, and I'm going to take the keys. That idea of trying to provide a safe environment around alcohol is pretty risky. The other piece too, if you really believe that your child's going to drink at your house only, and you provide that environment, and they're not bringing other drugs or anything else into that house, and when you're not hosting a party that they're not going to drink anywhere else, is pretty scary. So providing a safe environment for teenagers around alcohol just doesn't work. Myth number 5. I can't stop my kids from doing the same things that I did at their age. Yes, you can. Okay? The medical professionals and other professionals, the number one influence over our children are parents. It is still parents. All the different surveys, the influence of parents in talking with your child is the number one piece. Sometimes they tune us out, they drive us crazy, they don't want to listen, or you don't think they're listening to you, but they are. Myth number 6, weed isn't that harmful. I just wanted to say, and I'm sure the medical professionals will touch upon this, marijuana right now is like 13 to 20% stronger than it ever was. And actually, Colorado, with the legalization, within 2 years, they're developing marijuana that's 28% times stronger. So there's a market for strong marijuana, and that's coming. So the marijuana that was smoked in the 70s or 80s is nothing compared to what's going on out there today. Myth number 7. I'll set limits. If I set limits, my kids won't become popular. As the chief said, calling houses, calling families, finding out where they're going to be, double checking, going to pick them up at different households is very, very important. Children need those limits. And it is bad. I'm thinking as a principal, I'm thinking as a father of 2 daughters. There are some battles. But if they know that you are setting limits, and they know that you are going to check, and they know that you're going to do the things you need to do, it's going to help them with those decisions as we move forward. So at this time, that's my piece, and we'll bring up our medical professionals as we flip through this. Thank you.
Hi everyone, it's a pleasure to be here tonight, and I'm so thrilled by the quality of the presentations tonight. There's going to be a little overlap, but I think what we're saying more than once are really the most important messages of the evening. My name is Dr. Miriam Shizer. I'm a pediatrician at Boston Children's Hospital, and I work in our adolescent substance abuse program. We call ourselves ASAP. My job today is to give you a brief overview of adolescent substance abuse from a medical perspective. We're going to look again on what substances teenagers are using in 2015, with special attention to alcohol, marijuana, and prescription drugs. And I would like you at the end of my 15 minutes to really have a sense of why alcohol and marijuana are far more dangerous for teenagers than they are for adults. And then I'm going to leave with hopefully an uplifting note on what parents can do for this problem. I start a lot of my talks with this slide. I think it's really important and it gets people's attention. I want to show you the leading causes of death for children and adolescents between the ages of 10 and 24. And this is data from 2013. The most common cause of death is motor vehicle accidents. That's about 22% of the mortality. This is followed by other unintentional injuries, followed by homicides, and then suicides. And together, these account for about 70% of the causes of death in this age group. And what you'll notice is these are strikingly behavioral in origin, and all of these are independently linked to adolescent substance use. This is information from a national survey. It's called the Youth Risk Behavior Surveillance Survey. It surveys high school students across the United States. And you'll find that they were asked about their behavior in the last 30 days. You'll see that about 35% of high school students reported having at least one drink in the past month. About 20% of high school students reported heavy drinking. Again, I'm talking about in the last 30 days. 10% reported driving after drinking. You've heard a lot tonight about the mortality and morbidity associated with that. And then almost 25% reported being a passenger in a car when the driver had been drinking. So again, remember my opening slide. When we talk about the health impact of adolescent substance use, I think it's useful to think about it as two separate categories, immediate impact, immediate health impact, and lifetime, and both, of course, are equally important. Some of the immediate health effects are injuries, we've talked about that, overdose. You've heard a lot about the overdose deaths so far this evening. We're seeing a lot of emergency room visits and hospitalizations relating to substance use, physical and sexual assaults, teen pregnancy, and again, when we're talking about unprotected sex, we're also talking about sexually transmitted infections, and this includes HIV and AIDS. For lifetime health effects, we're thinking about brain damage, learning problems, a variety of different psychiatric disorders, and then this is a theme of this evening. You're going to see more alcohol and drug dependence depending on how early the person started. And I actually have a slide that illustrates this. All right. I think it might have been a minute, but I do have a slide that shows you that if someone starts drinking, we have a lot of very good data for alcohol. If a child starts drinking at age 12, they have about a 50% chance of having an alcohol disorder sometime in their life. You can think about it in lay terms as being an alcoholic. So you start drinking when you're 12, you have a 50% chance of being an alcoholic. Whereas if you delay the initiation of use, so if you start drinking when you turn 21, the risk doesn't become 0, it's about 10%. But that's really a striking difference, 50% chance versus a 10% chance. And our marijuana data looks very similar. So we talk a lot about this in my program, the developing adolescent brain or the teen brain. All right, so there's my picture. It's really important to think about, I think the take-home messages are teenagers are more vulnerable to addiction because of their developing brains. We think about how the brain is a little bit of a simplification, but basically the brain develops from back to front. And typically the brain doesn't reach physical maturity until mid-20s. That's a good number to have in your head, about 24, 25. And so we know that the structure that develops last is the prefrontal cortex, or the front of the brain, and that's what we use for impulse control, delay of gratification, complicated decision making. And teenagers just do not have that same capacity compared to adults. And we also know that developing structures are more susceptible to damage from environmental insults, toxic insults. And that's again a theme as to why marijuana and alcohol are so dangerous for the teen brain. So we've looked at data from Beverly, which is wonderful. I have some Massachusetts data about what kids are using. I think it's a little hard to see, but you'll notice that the green bars are middle school students and what they're doing, and then the blue bars are high school students. Another speaker had said, we know that use progresses as kids get older. And again, there are two things to be aware of. We ask kids about lifetime use. Have you ever used alcohol? Have you ever used marijuana? And then current use, which is defined as have you used in the last 30 days. So just kind of get a sense of what the numbers look like. And I would have to include tobacco in tonight's talk. It's really important to know that every day in the United States, 3,600 kids between the ages of 12 and 17 will start smoking. And the tobacco companies love this. They're counting on this, in fact. If you were to look at adults in this country who are daily smokers, about 90% of them have started as teenagers. And what's interesting is a lot of the teenagers who smoke wish they could quit, but they're already in the throes of that addiction. And there are other high-risk behaviors that track along with cigarette smoking. We know that compared to teens who don't smoke, teens who smoke are more likely to drink alcohol, more likely to use marijuana, more likely to use cocaine.
Basically, if you know that your child is smoking, you should be worried about other things that they might be doing. I'd like to say a couple of words about alcohol. So you've heard this earlier in the presentation. The take-home point is that when teenagers drink, they drink a lot. In fact, we know that 90% of all alcohol consumed by underage drinkers occurs in the context of a binge. We also know that alcohol causes brain damage. The hippocampus is the part of the brain that is where learning and memory is centered. And we know that the more you drink, the more damage there is to the hippocampus. I'm glad that the speakers have mentioned that there's this growing sense about marijuana not being harmful, but we know for a fact that it is extremely harmful. And again, I want you to remember the theme of the developing adolescent brain. There was a wonderful study done in New Zealand that looked at people, they checked their IQ at age 13, and then they checked it again in their 30s. And what they found was for people who smoke marijuana in their adolescence, they could actually show a significant drop in IQ when they rechecked IQ in the late 30s. This was not seen for people who never used marijuana, and also for people who smoked marijuana later in life. So it really speaks to the vulnerability of the adolescent brain. We know that there are mental health effects also associated with marijuana use. It worsens depression and anxiety. The more you use it, the more you see this.
There's also a very frightening link that we're learning more about, which is the link between marijuana use and schizophrenia. I think if you check in another 10, 20 years, we'll have this more figured out, but there's something that's emerging. There's clearly a link between the two. The more marijuana you use, the more likely you are to put yourself at risk for this disorder. I like to show this slide because it really just speaks to all of the different organ systems that are affected by marijuana use. We've already talked about some of the effects on the brain. Then you'll see the mood effects. I should also mention that it causes a lack of motivation and worsening mood swings in teenagers. We know that marijuana smoke is toxic for the lungs. There are also endocrine or reproductive effects. We know that marijuana use is associated with infertility. It can lower testosterone in males. And there's something very provocative that's emerging, which is a link to heart attacks in adults. And so the cardiologists are all over this, but lots of negative health effects. A lot has been said tonight about prescription drugs. This is a very important epidemic that we're seeing in our teenage population. I think others have commented on this false perception about safety. You know, why are kids using or abusing prescription drugs? I think it's that sense that somewhere some physician wrote a prescription for this, so it must be safer than street drugs, and that is not the case. I think part of it is our fault. These prescriptions have become widely available, and so that's part of the problem as well. Kids have different reasons for using them. Primarily, I'm talking about stimulants and narcotic painkillers. So the reasons include to get high, for euphoric effects, in the case of stimulants, to enhance cognition, and then for this phenomenon of self-medication. So I want to be very clear. I think others have talked about this as well. Painkillers are called opioids. This includes Vicodin and Percocet, and Oxycontin is pictured. This is the same kind of drug as heroin, which is considered an opiate. But often what happens is kids start by abusing painkillers, and that tends to be very expensive on the street. And so what happens is when they can't afford the opioid, they switch over to heroin. As I said, I think the medical community has some role here. Far too many prescriptions for these painkillers have been written. This shows you a trend from the early 1990s to 2013, and you can see how there are just more prescriptions being written. I think the medical community is onto this now, and so there are much tighter regulations. But you'll notice that this curve looks very much the same. This is the rate of misuse among 12th graders, and you can see it has a very similar shape. And so again, this theme that one of the reasons kids use prescription medications is it's so easy to get their hands on. If you ask teenagers, they say they get them from their own family medicine cabinet, maybe that of a friend. They're just easy to get. I saw this last week, and I knew I was going to be here tonight, so I reproduced it. This is a cover of the Boston Globe a week ago, and the lead story, you can tell, is describing this steep increase in opioid deaths in the Commonwealth of Massachusetts. So very alarming, really a public health emergency. So again, I promised to end on an uplifting note. The topic is now, what can parents do to prevent their teenagers from using alcohol and drugs? And the good news is parents really do have considerable influence over their young adult children. So this is a positive talk. Some of the studies show that something as simple as having dinner, having family dinners, will decrease the incidence of smoking and drinking in teenagers. Now, for some families, that's not an option. I think the important theme is to be connected to your teenager, whether that's at the dinner table or in another way. Know what makes them tick. Talk about alcohol and drugs frequently. I think Principal Gallagher alluded to this. Make it a topic of conversation. Make sure your kids know that you have a zero tolerance for any use of alcohol or any drugs. Be a positive role model. Watch their school performance. Know how things are going. Supervise their homework. Make sure things are status quo, at least in school. And also praise frequently. I think sometimes we really get lost in the negative when we're thinking about this problem. Again, know who your kids are with, know your kids' friends, know the parents of your kids' friends. If they're going to a party, do your homework, see if the party is going to be supervised. If not, they shouldn't go, and ask what we call the W questions. You know, what are you going to do, where, who are you going to be with, when will you be home? And something that's very important is waiting up and talking to your child at the end of their evening. That's really important. We've talked a lot about the risks of driving under the influence. I encourage you all to go home and sit down at your computer and look up the Contract for Life, which is a wonderful document. It's put out by Students Against Destructive Decisions, and it allows you to have a conversation with your child about the dangers and what you can do about it. I'm going to finish by talking about some of the signs of substance use in teenagers. Sometimes these are more subtle, but it helps if you know what you're looking for. Physical changes would include changes in sleeping and eating. Weight loss would be ominous, glassy or red eyes, nasal congestion. Flu-like symptoms can be associated with opioid misuse. There are psychological changes. We know that teenagers have mood swings, but if you feel like the mood swings are exaggerated, that's something to think about. Depression, anxiety, obviously something like a suicide attempt, and you would mobilize all the appropriate forces. There are cognitive signs as well. I think the #1 sign is a change in academic performance, dropping grades. We see kids in our program all the time that this was often one of the early signs. And also kids just suddenly lose interest in activities. That's something to be aware of. The social signs, I think the #1 sign would be a change in friends. Suddenly there's a new cast of characters that you don't know. That could be a concern. Change in appearance and also isolation. Suddenly your kid seems more isolated. There are some behavioral signs. I'd say the #1 is lying. If you realize that your child is lying to you about things, then that's something that you want to get to the bottom of quickly. Also, suddenly getting in trouble, delinquency, truancy. In my experience, if parents think there might be a problem, but they're not sure, there's usually a big problem. So you certainly want to act quickly. So you want to speak to a health professional. Our next speaker will be talking to you about treatment, but you want to get your child formally assessed if you think there might be a problem. And then again, another theme of this evening, remember that addiction is a brain disease. I'm here as a medical professional. This isn't a moral failing. This is a brain disease. And then you want to explore options right away for your child. Again, I work at the Adolescent Substance Abuse Program. We see patients in Waltham and Boston, and we'd always be happy to help. Thank you so much.
So good evening. My name is Gary Gassman. I'm from Leahy Health Behavioral Services. And I have the dubious distinction of being your last presenter of the evening. So I'm the last one that prevents you from going outside and enjoying the rest of the evening. And I do thank everyone for coming. It's a beautiful night. And by the show of support, I know that everyone is invested in the topic we're talking about tonight. So my message is going to be quick, but it should be perceived as a message of hope. I'm going to be talking about two things. One is around the services that exist in our community for substance uses, both for the teens and their families, as well as what community resources are available to both the schools, the teens, the family, and other community resources. And we all know that there is a paucity of detox beds in the state. We know that there's a need for more halfway house beds and transitional beds. But the message is that there are services available, and we are servicing people in the community every day. And that should be the message. There's a lot of qualified and competent and high-quality programs throughout the state that I was hoping to talk about tonight. And so the first thing I'm going to do is talk about the types of services that are available. And when I use the word substance use, it's interchangeable with substance abuse. Substance use seems to be the new nomenclature people are using. Let's see if I can use that. Great. So Leahy Health Behavioral Services has about 48 programs throughout the North Shore, from Boston to the Merrimack Valley and up along the seacoast, all dedicated to helping families with behavioral health needs. So the two things, again, I'm going to talk about, and I can't see that at all. Let me see. I haven't even hit 52 years old. Give me 1 second because I'm updating these here. Well, I'm going to wing it. I've got my slides here. I know that there are people in the audience right now that have called a substance use program to get help for either yourselves or your family, and you're told, I don't have a bed right now, I can't help you. And for me, what's important is to talk about is the right care at the right place at the right time for the right person. And so I'm going to talk about different levels of care, of services that are available in your communities. Okay, so I'm winging it off my sheet here because it's blurry from over there. So the first is what we call traditional outpatient substance use services. And that is typically done by a master's level clinician and or a multidisciplinary team. So it may include a psychiatrist, a nurse practitioner, the therapist, and the family. It's really important that I cannot overestimate the need to have family involvement in substance use counseling. You have the teenager that may have substance use issues, but it's the family that's impacted just as greatly, and the need needs to be there as well for the family to be participating. The next one is what we call a SOAP program, which is called the Structured Outpatient Addiction Program. It's sometimes also called an IOP, Intensive Outpatient Program. And this is a highly structured treatment. Individuals go anywhere from 4 to 5 days a week for up to 6 hours a day, for up to 6 to 8 weeks at a time. The purpose is to give the teen and their families greater insight into how the substance use has impacted their ability to thrive. And it may be at school, it may be in their family, it may be in their social connections. And we talk about relapse prevention, we talk about skill building, we talk about how the substance use and the biochemistry has affected their body and their mind. Next one is family intervention programs. And this is a service that the Mass Department of Public Health and the Bureau of Substance Use Services funds. And there are several of these around the state. And they are not brick and mortar programs, but yet they are social supports for the families in the community to help get more access, to get more referrals, to get more understanding of how substance use has impacted their lives. The next level is what we call residential treatment. And we're talking about teens today, so I'm talking about youth residential treatment, and we have 4 or 5 of these across the state that are licensed by the Bureau of Substance Abuse Services. And these are up to 90-day programs where teens cohabitate and live with other teenagers, ages 13 to 17, in a group living situation that is staffed by 24/7 staff that provides individual and group counseling and family support and intervention, with the purpose of, again, similar to the SOAP, is to help them understand how their substance use has impacted their lives. And typically, folks that are going to residential care, the substance use is so great that it has impacted their ability to thrive at school. They may have legal issues. They may have burned some of their bridges with their family and friends, and other forms of treatment have been minimally successful. So this is a fairly intensive situation because the individual is being temporarily removed from their house. It is a voluntary program, but the parents and or probation may require them to go. There's one locally in Danvers. It's run by Leahy Health Behavioral Services. It's a 15-bed boys adolescent program. And typically these programs are gender specific, so they're either boys or girls. The next level of care is what we call recovery homes, and this is where someone may go after the 90-day residential treatment. And these are places where, again, the teens, and they're usually 16 to 19, so they're a little bit older, go live in communal living situations that are, again, have 24/7 staffing, but the idea is to live in a sober environment so they can emulate the stressors of life, but having the support of staff around them. And they're there anywhere from 3 to 6 months. There's only 2 in the state right now. We're hoping that there'll be more down the road. I think that this is, when I talk about advocacy, I think this is an area where there needs to be more services. Is once they leave recovery homes, what's the next step before they get back home? And the last level of care I want to talk about is what we call youth stabilization and detox. So this is, many throw the word rehab. Rehab is a euphemism for detox services. And so we have adult detox services in the state and we have youth. And in this state we have 2 programs. We have MIR, which is Motivation Youth Recovery, and the CASTLE program. And those are two programs where teenagers go to detoxify from opiates, from cocaine, from alcohol, and potentially benzodiazepines. And again, they're ages 13 to 17. It's a medically supervised detox. You have a medical director, you have nursing staff, you have therapists, and you have a team working with the individual. And again, family involvement is crucial. Without the family intervention and family support, the likelihood for success once leaving is much more diminished. And the other piece to this programs are the fact of aftercare planning and referrals to the next level of care. As you may know, someone can enter a detox. They're there from anywhere, as an adult, for 3 to 6 days, or as a teenager up to 14 days. But the goal is for a detox is simply to remove the chemicals from your body. It's what happens once they leave the detox that's most important in terms of follow-up care and support. Piece I wanted to mention are recovery high schools. We have one in the North Shore, which is just down the street on Cabbage Street. We have Bill representing the North Shore Recovery High School here. It's been open since, how long would you say? 8 years. 8 years now. And there are 5 or 6, I believe, other recovery schools around the state. They're funded by the Department of Public Health, and they are schools, they're 4-year, non-traditional schools available to students that have significant substance disorders or problems that have impacted their ability to thrive in a traditional high school. And so they have group meetings, they have smaller classroom sizes, they are able to serve the students with individual education plans, and they have licensed clinicians on staff, and they have daily group meetings. Great rate of success. And afterwards, if you want to speak to Bill about that, he's available to talk more about that. So that's a resource right here in your community down the street. So keys to success after leaving treatment or leaving some type of service. You'll notice that the word family appears in there 3 times, maybe even 4 times. Again, I can't underestimate the need for family involvement, and that's however we define family. There's the traditional concept of family, but then there's a non-traditional. Family may be, in the perceived eyes of the individual, it may be an aunt or uncle, it may be a close friend or relative. So family is wherever that person wants to define the term family. But the family needs to stay actively engaged with supporting the efforts of the team. The family needs to demonstrate commitment, empathy, and support. Sometimes there's tough love, but there also has to be the need that you understand what they're going through and support whatever they need at that moment in time. The family needs to stay actively involved in post-discharge follow-up care through therapy and community services, meaning that the treatment doesn't end when they leave a program. It continues on with their family support. Utilizing community resources. So this is the other piece I wanted to emphasize, is that we have a fair number of very good community resources around the state and local to the North Shore, funded by the Bureau of Substance Abuse Services and other such programs. So the first one, and these are in no particular order, but I wanted you to know what BSAS stands for. So this is a state organization. It's the Bureau of Substance Abuse Services. It is one of the several bureaus of the Department of Public Health. But this BSAS is responsible for not only licensing substance use services, but providing funding for a multitude of different programs, as well as a great resource for community members and family regarding addiction and recovery services. So the next one is the SUN project, which is the Substance Use Navigation Project. And I believe we have some representatives from that project here tonight by show of hands. Great, so we have Ben and Leah, thank you. Also from Leahy Health. And this is a service that's funded by the Tower Foundation. The Tower Foundation is a local organization that funds many different substance use initiatives. And so this is a great resource that has very few restrictions and is open to teens, families, schools, and other community endeavors to help with several things: to provide assessment, to provide referrals, to provide transportation, to provide sober mentoring and activities, to provide community training to schools, youth organizations, and families. And both Ben and Leah will be available afterwards if you have specific questions you wanted to address with them. Another one is called the SAFE Project, which is also funded by BSAS, which is called Strengthening Adolescent Family and Empowerment. And so these are services that are available to families where the people are experiencing medical issues, legal issues, emotional issues, all related to substance use. And so this is a support to family members, and it's for teens aged 13 and 20 through 24. And in this case, it's not a brick and mortar program, but it's an outreach program. It's no cost to the families, and staff provide outreach in the home and in the communities. A couple more organizations, and this is not an exhaustive list, but these are some of the key ones in the community. Learn to Cope. Learn to Cope is a peer-led network of families dealing with addiction and recovery. They have a website. They have chapters throughout Massachusetts. It was founded by a couple of families that lost their loved ones due to opiate overdosing, and they have quickly grown into a large network as peer support throughout the Commonwealth. They provide both weekly meetings in various communities as well as online supports and educational resources. I wanted to highlight that there are 2 in your local community. There are 2 meetings every week, on Wednesdays at the Rhodes Baker Center in Gloucester, and again on Thursdays at Salem Hospital in Salem, and these meetings all start at 7 p.m. They're open to the public, you just show up. You don't need to go, you don't need an appointment. Smart Recovery, some may say is an alternative to AA. They don't talk about the higher power there, but again, this is a peer-led, non-professional-led organization where they provide face-to-face community meeting all over the state, and that's actually a national organization, and they also have an online chat room and forum and 24/7 supports. And I can't really see where we're at. Okay. So then we have the traditional AA and NA models. I put some websites up there. You obviously know that they have meetings, hundreds of meetings daily throughout the state, throughout the country. Take it or leave it. For many, it's a great support and a great resource. AA and NA, both for the individuals and the families. The other one, the last one on this list is assessment centers. And this is a term that you may not be familiar with. You may have read in the newspaper about 9 months ago that with the opioid epidemic, the former governor created an opioid task force. And through that task force came a few recommendations. One of the recommendations was that we need greater and quicker access to substance use services, so that when someone needs services, it is on-demand treatment. So in BSAS world, we have 6 regions. We're in the Northeast region right here, and BSAS has put out an RFR, request for a response, to fund 6 assessment centers throughout the Commonwealth. So we are fortunate to soon be the recipient in the Northeast and hopefully in the North Shore for an assessment center. And its sole purpose is to help individuals and their family access and engage a full continuum of treatment substance use services for screening, assessment, and remove any barriers that may currently exist in getting help. It's a 7-day-a-week program, and they'll be open for anywhere from 10 to 11 hours a day. They've yet to bid the award, and they've yet to identify the specific location. But that should be coming soon. I think the award was supposed to be made in February, and it's coming soon. So I think more to come on that. And the one slide that didn't make it onto here, and I apologize, is MORE. MORE is an acronym standing for Massachusetts Organization for Addiction Recovery. And MORE's been around for many years. We have some representatives in the audience I see here. And their purpose is for advocacy, for public awareness, for education, all with the understanding to educate the public around the value of recovery. And so I thank you for allowing me to speak tonight.
Okay, just a couple last points before we conclude. I think this is our approach at the Beverly Public Schools and working with Mayor Cahill in his office, in the DA's office, is that we fully understand that we all have responsibilities in working to keep our children safe and making good decisions. So there's a lot of different programming and professionals that work within the schools that you may not be familiar with. We have materials, as District Attorney Blodgett said, that we utilize from the DA's office. We also have a memorandum of understanding with all the local law enforcement agencies, and we meet monthly with the DA's office, Beverly Police, Probation, Probate Court, and we actually talk about trends and things within our community. And we also talk about the health and safety of our children, where we feel we get reports on things that have happened outside of school that we can provide services for those children and their families. There's something that might have happened outside of school. The City of Beverly, our school department, we collaborate all the time. Middle school and high school health teachers. The medical professionals that you heard tonight are always offering their services and expertise for Beverly High School and Briscoe Middle School and throughout the district. North Shore Recovery High School has been a big asset for us in a lot of different ways, especially for the peer-to-peer counseling that some of our students take advantage of over there. The Substance Abuse Prevention Coalition, Emily Rockwell and her office in Coordinated Child Welfare has been so helpful with a lot of the educational programming. In addition, she also provides speakers for us throughout the school year, all different topics. As I said, our wellness department, and you can't forget our citywide PTO and the school PTOs for their involvement, always enhancing either the curriculum or addressing some of the issues that our community faces on a monthly and daily, weekly basis. And then also our Students Assistant Program through the United Way. So I think Beverly has always been a special place. When there is a need, people rally together. I'm just really proud to be the principal here and have been worked here for the past 10 years or so because it does take a village. And I think everyone has the best interest of our students and to do what's right. I want to take the last slide here and kind of thank everybody. And before we conclude, I'm going to bring up some staff members so you can have access and put a face and a name to some of our adjustment counselors, school nurses, and resources here. And we'll be available afterwards to answer any individual questions that you may have, or you can also email us if you have some questions later on. Also, I'd ask Miss Betty Taylor to come on up because in the advertisement, we did say there are door prizes. So some people are gonna win door prizes tonight, and that's very important to us. But I also want to take a moment and recognize Senator Lovely, who's been for the past couple months working with us and has really vested interest in doing what's right and helping us at the state level. So she deserves a round of applause, Senator Lovely. Also, Chris Silverstein, a school committee member who's part of our drug task force and also serves on a lot of other committees who really push this program. Chris Silverstein. And I think just from working with Chris and talking with Chris and Mayor Cahill, this is just the beginning. We plan on setting up a lot of different seminars and workshops with parents all throughout the next school year to address a lot of these concerns that we have raised tonight. And then also Miss Emily Rockwell, I'd like to thank her for all her help right there next to Mr. Thomas. I'm not sure if Rob Hunt is here tonight. Oh, yes, he is in the back. There you go, Rob. Thank you. YMCA. Been very helpful. Be Healthy Beverly. And then also a couple other school community members. Miss Lorinda Visnick is right here up front. There you go. And I know, I'm not sure if Paul Manzo is here. He was at the baseball game. Yep, he made it. Paul Manzo. I just want to thank them for all their support and what they do for the Beverly Public Schools in the community of Beverly. At this time, I'm going to call up some of our professionals, and if you could come up to the front, our adjustment counselors, Mark Thomas and Helen Gorman, come on up. These are the Beverly High School adjustment counselors. Who work with our students on a daily basis. So if you have questions, any parents have questions afterwards, come on up. I know our nursing staff is here. If they could come up, Kim Pappas, Kathy O'Bear, and Jody Elder. I want you guys come on up. North Shore Recovery High School, Bill Hirschau, come on up. And then Sean Huth works with us in our adjustment counselors. Am I missing anyone else? I think that's... And then all of the speakers that spoke tonight will also be here for any individual questions. And now, Ms. Taylor, we have the door prizes, the most important part. All right, here's, you want to, all right, row and seat number. Okay, here we go. So this is how we're doing this. You may not want to leave yet because you could have the magic seat. They might take your prize, you never know. We have row D, seat 116. Row D, seat 116. Ms. Taylor, you might have to help them out. What's that? First on the move. Do you know where they are, Ms. Taylor? A, B, C, D, 116. You might have to help them out. It's empty. All right, how about D101? D101?
Bingo.
All right.
Won't get known. Just go for the closest person.
All right. How about G121? Row G121. This is like Battleship. All right? All right, Miss Taylor, you're going to have to make random distribution.
121?
Yeah, it's all up to you. Right there, that young man with his hand up. He came in, and there you go. He's one. Miss Taylor will hand out 5 door prizes. And then last but not least, Miss Julie Angelo, head of our guidance department, will also be here to answer any other questions. Once the door prizes are handed out, we will conclude. All right, I just want to once again thanks for all the parents and guardians that are here tonight, also our students that have come. And as we said, this is just the beginning to work together on a constant basis to do the best we can to keep our kids safe and help them make good decisions. Thank you all and have a wonderful night.